y'all, it's me, Nurse B. I am a registered nurse, a nurse mentor, and your biggest cheerleader, especially if you are currently in nursing school or if you're interested in the nursing field. Do me a favor, go ahead and like the video, hit subscribe, because I'm going to have even more nursing school student motivation coming soon. So on today's video, I want to jump into something for those that are closer to the end of the road with nursing school and talk about what should your first job be. So you have some people that think that you should start out like med-surg or ICU, something like that. And then you have those that say that you can just jump into whatever specialty that you would prefer to. And so I have some mixed feelings about that. I feel like nursing school is the best opportunity to kind of get your feet wet and dip into the different specialties that may interest you. I started out personally in med-surg. I knew in nursing school that I did not want to work in the hospital setting, but I worked there long enough to get my year or so of experience, and then I went on to other specialties. One thing for sure, nursing school really pushes the hospital, long-term care facilities, but just always keep in mind that the field of nursing is so open, y'all. It's so open. Any industry that you can think of, I guarantee you it's a way to be a nurse in that industry. Anything from aesthetics and the beauty industry, law, being a legal nurse consultant, the list goes on and on. So when I started nursing school, I just knew I wanted to be a labor and delivery nurse. Really, what I wanted to do was be a NICU nurse, be a neonatal nurse practitioner. So get some experience in the NICU. However, when I got into nursing school and we were doing our L&D rotation, I quickly realized this is not for me. This is not what I want to do. So use your clinical experience as a way to, again, get your feet wet and just enjoy the different areas that you're going to go in and see where you go from there. Now, I do think it's a good idea to start out in med-surg because you're going to get a little bit of everything as far as different disease processes, different patients, and that sort of thing. But if you absolutely know for sure, I want to do ICU or I want to do labor and delivery, and you've gone through those rotations in school and it just solidified the fact that that's what you want to do, or I want to do emergency room. If your clinical rotations have solidified the fact that that is what you want to do, then I wholeheartedly feel like you should go for it straight out of school. A lot of hospital facilities have RN residency programs or student externships. Take advantage of those. If this is your last semester of school, go ahead and start looking for those type jobs, the residencies, new grad, student externs. Go ahead, start looking for that type of thing. A lot of them will actually allow you to rotate different areas, and you're getting paid to do it. So that's what I really suggest. If you're still not sure what area you want to work in, then I could definitely suggest that you try med-surg first, just to get a foundation. And then just keep in mind that the field is so open. Once you get a year or two of med-surg under your belt, you can pretty much go anywhere. The same thing with ICU. If you're an adrenaline junkie, that's just really your passion, or ED, adrenaline junkie, and that's your passion, go ahead and start there. And then you can pretty much go anywhere, any specialty, any floor, and you should be fine. Of course, there's always some differences, but having those types of foundation is going to help you out in the long run. So when I first started school, like I said, I thought that I wanted to be a labor and delivery nurse. Quickly learned that it's not what I wanted to do. I got out of nursing school, and again, I started with med-surg. I already knew in nursing school that that is not what I wanted to do as far as the hospital setting, but I went ahead and did it just to get the foundation. It took me many years, a couple of years, to find that my passion was school health, working with school-age children. So pediatrics, school health, that type of thing. So what I will say is don't be afraid to try different specialties. Go ahead and get your foundation. but don't be afraid to branch out and try new specialties. OR, IR, GI, respiratory, med surge, ICU, step down, all the things. Don't be afraid to step out. Also, don't be afraid to look at some areas outside of the hospital as well. So long-term care, aesthetic nursing. I know there are a lot of those in the beauty industry, like hairstylists or makeup artists, estheticians, that go to nursing school. So there is a field, aesthetic nursing, that would be perfect for you if that's what you want to do to kind of bridge the gap between your passions. So that's the advice that I have. If you're not exactly sure, med-surg is always a great place to start. If you like the adrenaline, fast-paced, ED or ICU is a great place. But definitely look at facilities that have some type of residency program. Unfortunately, I'm not sure if there are any for LPNs. I'm sorry, but I know for sure there are facilities that have RN residency programs. Student nurse externs. Look for those. That's what's going to get your foot in the door. And 9 times out of 10, if you're a student extern, they're gonna have a job for you. Again, 9 times out of 10, not 10 times out of 10. So most likely they'll give you a position. I was in student extern or graduate nursing student extern when I started out. And once I graduated, they paid for my HERS review and ended up giving me a position on the floor that I was externing on. So definitely check those out. Keep that in mind. And just remember that nursing is so open. The field is so open. There's so much that we can do as nurses. So again, I wish you the best of luck. And remember, you got this. Definitely contact me if you have any questions about anything that I've gone over. And I hope to see you in the next video. See ya.